One of the greatest things I think is when I finish a surgery and I'm able to know that we did a good thing for the child and tell the parents and see how grateful they are, how thankful they are. Because in the end, I try to treat them as one of my own family members. And at that time, when I'm doing surgery, they're my only focus. I come from a long line of physicians in my family. I saw what they did and I appreciated that. And it became apparent to me that it's truly an honor to get to do what we do as physicians. And for me, there was no other choice. And for me, working with kids is the best thing possible. I actually thought I would be a pediatrician because I knew I loved the pediatric population and kids were always who I wanted to work with. But then I realized, you know what, I didn't want to necessarily do the primary care, but it was really the surgical field and the ability to operate on children and give them, a quick result that drew me to surgery. And so then when I became a surgeon, I realized that pediatric surgery was a perfect combination of the two things that I truly loved. As a surgeon, we have general surgery residents on our service as well as medical students. And I think the only way to impart your knowledge to the next generation is really be involved in their learning and their teaching because they're going to be the future surgeons. So that's one other part of my job that I truly love. I like to explain to the parents everything that's going on and what my thought process is as to what we need to do and why do we do it. I mean, sometimes I even draw pictures for them to make everything clear for them. And then I also speak to the children if they're at that age where I can talk to them. And then I always ask them if they have any questions themselves and the parents as well. And I try to be as thorough as possible. The small babies are actually some of my favorite operations and some of my favorite patients to take care of because I find that they're the most vulnerable of our population. And their families entrusting their tiny baby's life to you, and I consider that an honor. I do get attached to my patients, but I don't think that's a bad thing. I think it's part of my nature that I do care a lot, and it's a privilege to be able to work here, to be able to take care of the population here.
Me? What?